Hey everyone, Dr. Tanner Dobson, and in this video I'm going to be going over the installation of an all-on-5 dental implant bridge that we did for a patient. Here's a scan that we took when patient initially presented to the office. You can see that all the upper teeth are pretty much broken off, infected, and all the lower ones have pretty severe gum disease, big cavities here and there, and all those lower teeth were loose. So you encounter a situation like this, and there's nothing you can really do other than remove the teeth and plan to replace them with either dentures or implants. In this case, we decided to do a lower full implant bridge. So we removed the teeth and placed 5 implants. You can see here's a clinical photo showing the implants in place. And then here's an x-ray showing another scan of the implants in place. Surgery went down smoothly. We were happy. The implants all integrated well. So we are now going to go over the process of how we make the bridge before we install it. We made an upper denture for this patient in this case, which was the original plan, but we ended up making upper implants. Anyway, here's a scan that we take. You happy with the parallelism of the implants. That scan then gets sent to a computer-assisted design software where we design the bridge, the teeth, and then it gets milled out in this milling machine that I have in my office here. This chalky white substance will then go into an oven and get baked and shrink down and turn into a tooth-looking color like this. Super dense material. I'll apply a layer of stain to the gums so that it looks somewhat lifelike, and then we're ready to install it on top of the implants. There's 5 little screws that poke out the bottom, and they just get screwed onto the implants that I'll be showing you for the upper in this video here. There's an x-ray showing the lower implant bridge and the upper denture. Patient liked the lower implant bridge so much that they said, hey, I want to get rid of the stupid denture. So we ended up putting 5 implants into the jawbone about 4 months prior to this appointment, and then making this upper implant bridge. Here's an x-ray showing the implants after the surgery. And then we design our implant bridge that I'll show you the design for shortly here. The plan was to make, there's the implant bridge there, and then here is a web view of the CAD software showing the design. I don't design these things, I just manufacture them, but we were pretty happy. We got away with a pretty slick design for this one. The sleeker you can make it, the more natural it will feel, the easier the speech is and function. I was quite happy with the design of this implant bridge. You didn't even need to have gum tissue on it, so something like this is going to feel very natural in the mouth. We will basically remove the healing caps, which I was doing initially during the starting footage of the video, and then we'll, basically just screw the fixation screws into the 5 implants. I'll use this little finger driver first to tighten them all down to finger tightness before taking them down to spec with the torque wrench. So the next few minutes is just going to be screwing down the screws. By the way, this is a procedure that I usually don't even need to freeze for. I think we may have frozen a couple spots that were pinching, but I use these, they're called tissue level implants that I'm a huge fan of. The literature that I've read says that they retain the bone around the implant better than their bone level counterparts. And that's important for a long-term result because implants can get gum disease just like teeth can. So what's the maintenance that goes into maintaining something like this? I'll give this thing a big shake, by the way, before tightening it down fully, just to make sure that everything is fully sat. These things can fracture when you're installing them if it's not designed properly, or if you torque it down too fast. Maintenance involved in an implant bridge is water pick. You got to water pick every day to clean the borders because food gets all around the mouth and it needs to be cleaned to prevent food and plaque from building up underneath the bridge. Although there's pretty firm contact between the bridge and the gums, water pick is essential to keep the bridge maintained. Here's the lower one. You can see I'm just kind of poking around there. It is in situ. And then the upper one, yeah, we were happy with the look. You can see that the gum tissue is kind of blanched a little bit white, and that's because it does put pressure on the gums. It's going to feel tight for, a day or two until it accommodates. We're going to check the bite with this articulating paper, and we were happy. We were very happy with the bite. In this case, actually, we didn't have to make any bite adjustments, which is kind of rare, but it's always nice when that happens. And then once we're happy with the bite and how it looks, then we're going to plug up the screw holes. So we will rinse and dry them thoroughly, and then we actually pack in some Teflon tape first over the screw head. And the reason that we do that is so that we can access the screw head in case we ever need to remove the bridge, which isn't a bad idea to do once every couple of years. Remove the bridge, clean the underside of it. Sometimes, calculus might build up a little bit on it, tartar that you can clean off, and then you can just put it right back in. So these things are retrievable, but they are fixed. They're not removable. They're in there solid. You can grab these things and shake them around, and they don't go anywhere. So we'll pack our Teflon tape into the screw hole and leave 3 to 5 millimeters of space to fill in with a standard dental composite filling material. We're gonna pack the second screw hole here, and then you'll see me injecting in a flowable dental composite to fill up the screw hole the rest of the way. We'll overfill it a little bit, and then we'll trim it back after. So I'm going to fill up the screw holes, and then Jackie's going to cure the composite there. I'm hoping to use this little camcorder device, which I just got recently. I have a couple of these implant bridge surgeries in the pipeline here, and I'm hoping to use them to record the surgical portion of this procedure, which I figure that might have some interest. So if this type of content interests you, or if you're interested in dentistry in general, then feel free to follow this channel. You can leave a comment, or if you have any questions, then I'll answer them personally in the comment section there. So we have plugged up the screw channels, and then we're going to trim back the composite filling material with a high-speed burr, and then this thing's ready to go. Patient gets sent home. They're happy. They like these things. Takes a little bit of getting used to, of course, but they work. I've probably done about 14 of these things at this point, and they work great. There's an X-ray showing them in place, and then there's a photo showing the patient smiling. He was happy. Thanks for watching.